Igniting the good news on your screen.
Of the time, if you said people should go and do malaria parasites, nothing might not be there. So, but some people will say, malaria yìí òun láìsàn mi, òun ní àrùn mi, so ó ti di bárakú. No, there's nothing like chronic malaria.
There's nothing like that.
I don't think so. Because chronic, if you should say something is chronic, it means that it has been there, and it's not getting out. So if you want to talk about, there are chronic disease, but there is no chronic malaria. We have chronic diseases, but there is no chronic malaria.
Mommy Adebute, chronic, I'm still back at that chronic word. Ẹni tó sọ̀rọ̀ yìí ó sọ with confidence. Malaria àbí paracetamol tẹ́ ń lò yẹn ó kan tó ní national body ló prescribe fún malaria, testunate tàbí ló ń lò tẹ́lẹ̀ artemether, ó lògùn yẹn kò ṣiṣẹ́, ó ní fún màá yẹn bá tó lọ ṣe test náà bá tó dé ó wá ń ka kínní, ó ní chronic malaria lẹ́nìmà. Chronic malaria yẹn kí ló máa ṣe, ó ní ó máa ra kíní omi yìí, kí ló máa ń pè omi drip, ó ka drip yẹn rẹpẹtẹ tó máa fún ẹni yẹn kékeré àti ńlá, ó ṣàǹtẹnumọ́ pé chronic malaria. And I want to ask you, ma, Mami Adegbite, ṣé àìsàn kan wà tó jẹ́ pé téèyàn bá wá lọ ṣe test, ṣó possible kéèyàn ní malaria àti typhoid papọ̀ lẹ́ẹ̀kan náà?
Thank you. Ó ṣeé ṣe kéèyàn ní malaria àti typhoid papọ̀. Èèyàn lè ní malaria kó ní typhoid, kó ní hepatitis, kó tún ní some other diseases at the same time. Yes. But ibi tèmi fẹ́ gba Yorùbá tí mo fẹ́ try láti sọ ni pé chronic malaria tẹ́sọ yẹn nìkan lèmi fẹ́ refer sí. We have malaria and we have severe cases of malaria. You cannot refer to malaria as being chronic. What is chronicity and what is chronic? Chronic is existence of a particular disorder in the body system beyond a duration of between 6 months to a year. That is chronicity. And you can refer to some cases as being chronic. Some has been acute. When you say acute, it means it comes suddenly and it's just occurring. And that is why you refer to it as acute condition. When it becomes a chronic condition, it's been there for a while. So there is nothing specifically about chronic malaria. Put that aside. There is no situation that fluid drip will treat malaria. It's not part of the medication. Yes. Peradventure, if the patient has lost a lot of fluid, maybe probably through vomiting, stooling, or what have you, or there is dehydration as a result of inability to eat or take fluid for a long time, then and then there can be rehydration, that you want to give fluid to replace the fluid lost during the period of vomiting, during the period of stooling. You want to replace it, and that is where the drip can come in, not because of malaria. Not because of malaria.
You cannot apply this fluid into malaria people.
It is not inculcated, except if the malaria patient, the patient with malaria parasite, presented the symptoms of dehydration as a result of vomiting, stooling, or inability to eat or drink for a long time. The patient may have typhoid. When there is typhoid, the patient might not be able to eat, may present very weak. Most cases, vomiting, inability to take anything, all these might have deprived the patient from fluid, and the glucose level might be low. At this point, if the patient cannot tolerate orally, you want to try as much as possible to rehydrate by giving fluid. The fluid is not just ordinary fluid. We have some of them with normal saline, some of them with glucose, in order to replace the glucose deficiency given by inability to eat.
Malaria and typhoid at the same time.
Yes, you can even treat 3 or 4 more amens at the same time. Yeah.
Maybe that is the reason why it was applying.
Assuming a patient comes in with malaria and typhoid, what you are using for the malaria is not the same thing you are using for the typhoid. So collaboratively you can treat the two, because you can't leave one for the other.
But there's an assertion that when you give only typhoid, you cure malaria at the extent.
No, there is nothing like that. What you use for your typhoid might be you are going by amoxicillin, or you are going by ciprofloxacin, or you are going by augmentin, or whatever. What have you?
Can't that
All this.
influence malaria?
No.
Well,
You can't just use drug
there is this-
anyhow.
There is this notion that malaria, typhoid is an higher malaria.
No, there is no descent or upward in malaria. Malaria is a parasite on its own. Plasmodium falciparum is the causative of malaria,
You know the reason why
and the one for the typhoid is another
the
thing.
reason why Peter and Gbe, some masses of the country, some of us our kan wọn kí n lọ sí hospital in Japan, but we rest on nurses around and all these pharmacist jobs around, and when they say medical terms, you felt eléyìí ti ṣe lọ hospital. There are medical terms that ordinary citizens don't understand. When they know that we don't understand, so they capitalize on our ignorance and say such. Mo ti gbọ́ pé nìkan sọ wípé typhoid higher malaria ló ń pè ní typhoid, kọ́ tí mo gbọ́ ni mo ń sọ yìí, and I'm a person that wants to know, and when he says higher malaria ní typhoid, kò dẹ́ ṣe mi nìkan ló ti sọ sí, kíní ti wà ní neighborhood, àwọn èèyàn ti mọ̀ pé tó bá ti ní typhoid báyìí o malaria ni mo ní tẹ́lẹ̀, tó sọ pé ok àbọ̀ mo lọ ṣe test ní wọ́n ní malaria, wọ́n tún wá ní mo ní typhoid, so mi ò ní láti treat malaria tí bá ti treat typhoid, torí pé malaria yẹn àwọn oògùn tó àwọn typhoid yẹn àwọn oògùn tó lágbára ló máa fi treat ẹ̀, so invariably téèyàn bá ti wá ń gba treatment yẹn lọ ṣe ni mo máa pa symptoms malaria yẹn tó máa fi kú, nǹkan tí mò ń sọ nìyẹn.
Nǹkan tẹ́ ẹ̀ ń sọ yẹn kò yẹ kó rí bẹ́ẹ̀. It's not right. Kò sí nǹkan tó ń pè ní ìkan tóbi àbí ìkan kéré ní malaria. Nurse tó máa sọ bẹ́ẹ̀ yẹn is either an auxiliary nurse, a trained nurse that has passed through a pharmacological course, knew quite alright that the organism that cause malaria is different from the organism that cause typhoid. Definitely. The presentation, and that is why we are advocating. This is a forum to advocate that there is nothing like identification of symptoms by itself. Even the rules in the medical field says let the next person diagnose you. Yes, even if you are a doctor, most of our doctors, they will have one thing or the other. They will still come to the clinic to see the next doctor for consultation. Let the next person do it. So you can't just stay in your room. Identify your symptoms. There are some physical symptoms when a patient comes in. It's not everything you see. A patient that comes in so dehydrated, sunken eye, very weak, ó rẹ̀ ó kàn ń tiraka wọlé ni, ó gbìyànjú wọlé. Òun gan lè rò pé okun ṣì kù nínú òun, but nígbà tó bá rí èèyàn tó mọ̀ ọ́n wò, ẹlòmíì wọlé ẹsẹ̀ ẹ̀ ló máa wú, ẹlòmíì ojú ẹ̀ ló máa wú. But nǹkan tó gbé wọlé ó lè jẹ́ pé malaria lásán ni. But tó bá lọ sí the appropriate place, the physical assessment by the medical person seeing that person, ó máa sọ fún pé kí ló dé tójú yín, ṣé bójú yín ṣe máa ń wù rè àbígbà tí sickness yìí bẹ̀rẹ̀ ló ṣẹ̀ṣẹ̀ ń wú, ṣé ẹsẹ̀ yín wú àbí nígbà tí sickness yìí bẹ̀rẹ̀ ló ṣẹ̀ṣẹ̀ bẹ̀rẹ̀ sí ní wú. And that is the advantage of going for medical treatment. It gives insight to not even what you are presenting. During the course of investigation, you discover a lot of things. Yes, a patient comes in with stooling, vomiting, I've taken a lot of drugs, I've been taken to a lot of hospital. A medical person there, what they decide pé okay, ẹ lọ ṣe test ẹ fún XYZ. Tó bá dẹ̀ ṣe XYZ, wọ́n á rí pé HIV patient. patient mi ikọ́ lásán ló gbé wọlé ó ti wúkọ́ mo lo oògùn kọfta mo lo this mo lo that oríṣiríṣi orúkọ oògùn náà máa dá láwọn tí wọ́n ń rà lọ́dọ̀ àwọn nurses tẹ̀ ń dárúkọ wọ̀nyí kò lè jẹ́ registered nurse àbí registered midwife ló máa sọ pé typhoid advanced malaria ni because the causative factor are differ. Even the presentation of symptoms sometimes might be differ, but because people believe àwọn èèyàn ti gbàgbọ́ nínú ara wọn pé ẹni tó rí ń fọ́ tí òtútù mú obviously malaria ló ní àbí ìgbà míì èèyàn kan ní nígbà tó ṣe òun bẹ́ẹ̀ typhoid ni kí ló dé tá a lè gbé ìgbésẹ̀ akin láti rí i pé a ṣe nǹkan tó yẹ ká ṣe kí wọ́n dẹ̀ discover nǹkan tí ordinary malaria tẹ̀ ń rí ẹlòmíì máa padà ní cerebral malaria á bẹ̀rẹ̀ sí ní sọ kọ̀tànkọ̀tàn malaria náà ni kí ló dé tá à ń dúró dè gbà yẹn nítorí pé à ń delay seeking the right assistant as a result of self-medication.
Thank you, ma. Thank you, ma. Let me now come again like this. Can we start treatment without the test? Ẹlòmíràn wọ́n máa sọ pé àkíyàn lọ ṣe test. Wọ́n máa ń kọ ìwé pélébé kan báyìí pé mo lọ sí lab. But outside the hospital, tí náà sọ kí ló ń ṣe yín? Orí ń fọ́ mi. Wọ́n sọ fún mi àwọn medical doctor kan tó ń wá dọ́dọ̀ wọn sọ pé bros, what happened now? Okay, I get malaria. Go and use malaria tablet now. So you know what it's doing. Go now. But outside the hospital, kí ló ń ṣe yín? Ẹ máa ń oyin máa ń kọ yín and ẹgbẹ́ máa ń dùn yín and malaria ni o. Ṣé proper medically can treat without test, without investigation? Ṣé proper?
Like investigation is not proper, but doctors come and treat patients. Wọ́n máa kọ́kọ́ assess patient. Ẹni tó wà yìí ṣó máa lè afford kó kọ́kọ́ ṣe testing wọ́n tó treat ẹ̀. Tán bá wò tán bá rí i pé táwọn bá ní kó lọ run test kò ní lè afford treatment. Wọ́n lè wá wò pé typhoid ló máa jẹ́ kò jẹ́ ká treat ẹ̀ fún typhoid. Tán bá ṣe bẹ́ẹ̀ yẹn lẹ́ẹ̀kan ṣoṣo tán bá ti rí i pé ó wà okay. Tán bá ti rí i pé kò wà okay, the next thing ni pé ó gbọ́dọ̀ run investigations. Kò proper láti treat èèyàn láì run investigations. Wọ́n gbọ́dọ̀ rí kó run investigation. Wọ́n rí i pé ẹni yẹn ò lè afford àti run investigation kó tó afford treatment. Tán dẹ̀ ti rí i pé gbogbo nǹkan tó sọ yìí nǹkan tó ń ṣe ẹni yìí wọ́n lè treat ẹ̀. But tán bá ti wá treat ẹ̀ tí ò wà okay, ó máa run investigations kó tó lò.
Mommy, during the course of treatment, so possible kí having a treatment damage or cause an havoc to a system of the body. Ìyẹn ni pé nígbà míì èèyàn lè máa fẹ́ like motor vehicle now. Wọ́n lè máa tún nǹkan ṣe, àkí nǹkan máa ṣe kọ́kọ́ yẹn máa tètè tún ṣe. Maybe ó ti wá fẹ́ damage tó kí ẹ wá tún ṣe, kí nǹkan mi tún wá yọjú while you are treating. So possible kéèyàn máa treat malaria lọ tó level kan kí another ailment wá padà yọjú. Ṣé nǹkan tí mo sọ yín wá pé mo ń treat malaria lọ báyìí o, another disease tún wá come up.
Hallelujah. That is why you don't treat blindly. Blindly. Ó wà very very important wípé tí patient bá ti present a ní kó lọ ṣe investigation. Kódà gan out of that investigation bóyá tó bá ní kó ṣe investigation méjì nínú méjì yẹn ìgbà tí result yẹn bá máa jáde a rí i pé multiple investigations ló gbọ́dọ̀ ṣe. Then àwọn nǹkan míì tó tún máa jẹyọ bóyá ẹni yẹn tó gbà tó dé hospital lẹ́yìn bóyá ó ti ní ìmáàdì pé common malaria ni mo ní tó ti diagnose rẹ̀ by the time tó bá ṣe investigation bóyá ó ti wòye pé kí n lọ sí hospital wọ́n treat mi kí n padà sílé ẹni yẹn lè lóṣù kan torí pé ìgbà tó bá ti ṣe investigation another one á tún máa yọjú so and the best thing ni pé kán treat gbogbo ẹ̀ once and for all. And àwọn patient kan wà tó jẹ́ pé saboteur ni wọ́n bá sọ pé pé kíní nìkan ni mo fẹ́ kíní kan àwọn náà máa sọ pé wọ́n sá.
Mass, in this course of discussion and in our health, mo wá fẹ́ béèrè finally ma Mọ́mì Adégbìtẹ́, what advice can you, because investigation dem sọ yìí náà, all hospital premises kankan ní investigation lab wà, we have them outside, many as possible. Mo dẹ̀ máa ti ń gbọ́ táwọn yìí máa ń sọ pé wrong diagnosis, wọ́n máa ń fún ní wrong result. Let me give you a typical example in Nigeria. Gani Fáwẹ́hìnmí, ìgbà tó kọ́kọ́ ṣe test ní LUTH, wọ́n fún ní result kan, but when he travel out, another thing came up. Another person is Dora Akuyili. Ìgbà tó ṣe ní LUTH ló náà ṣe tiẹ̀, ìgbà tó travel out, another thing happened. And LUTH is not just an ordinary hospital. In the hospital, you're not to share. And all your belief assertions now is that there should be an investigation. And they went, they presented themselves for investigations. And later, those wrong investigations killed them. Mommy, the final talk on it.
Thank you. Technologically, you cannot compare our own locality here with abroad. I want to tell you authoritatively. You can't see any case of power shutdown over there. We have some of these chemical investigation kits and everything that needed to be preserved in a cold chain, in a freezing point. And we have cases where we have power shut down, yes, within the laboratory, in which this particular agent, reagent, the kits, and what have you used for this investigation will be exposed to a particular temperature with which the reaction expected might not be perfect. So you cannot compare. I want to tell you, and that is why you see them doing something here and the something is saying moderate. And when they get there, the thing is saying severe. Because the type of reagent we are even using, you can't compare it. You want to compare the type of reagent, the preservation of reagent, the handlers of the reagent, and every other factors are surrounding those issues. So if it is just investigation of the people that you talk about, I will not rely on that to act. But I will still encourage people that whenever there is problem, we should endeavor to investigate. Because most of the signs and symptoms we have mimic each other, some mask each other. You might not be able to realize this is so. Yeah, somebody came in on an investigation, you palpate, and you saw a lump in the breast. Ma, this is a lump. Let's go for investigation. If she has gone for investigation, the investigation might have told us, nǹkan tẹ́ ẹ gbé wá yìí kì í ṣe ordinary lump, pé malignant tissue ni. Á dẹ̀ tètè lọ fún removal. But nítorí pé wọn ò lọ investigate, ìgbà tán bá máa fi tají nínú ojú oorun wọn láì ṣe investigation yẹn, ọyàn yẹn ti lè bẹ̀rẹ̀ sí ní sẹ́mi. And at that time, ó lè ti wà ní stage 3 of the CA, ó lè ti wà ní stage 4. Ìgbà míì, most of them come to Etonawas hospital, metastasis has taken place. Metastasis means the thing has spread to the whole system. So coming in for removal, coming in for any drug or coming in for any medication will only be for palliative, for relief of symptoms, and will not heal anything. It's just to prolong life and to relieve pain. That's all. So I still believe we should investigate.
Finally, Mommies, can I advise the viewers to go for multiple investigations, maybe 2 or 3 places, before believing a test or a result?
No. Instead of going from pillar to pole, go to the very good laboratory. I will not mention names, but you cannot compare a laboratory of a person that has gone for another course. Work within a laboratory for a while, observe whatever they are doing, watch and observe, and decide to open or establish a laboratory. We are talking about a well-equipped laboratory manned by, we are not doing any advertisement.
How would you know or recognize a well-trained lab?
When you get to any laboratory, if it is Lagos, you will see the FMR registration outside. They've screened, they've investigated, and they've approved the premises and the personnel working in that type of laboratory. Yes, it is better for anybody to go to that type of laboratory. And the art of allowing somebody under your room to tap your blood and say, I want to take it for investigation, is another issue. Yes, that's another area we need to advise ourselves. During the course of taking the blood sample, that we have some of those specimens that must not be shaken, that must not be missed, that must be kept still. We have some of them that should not be given, that must not be exposed to a particular temperature before taking it to the laboratory. The handlers, when we have 40 handlers, we have 40 results. So I will still advise my people that we should go to the right place. Yes, when you get to the right place, you see the signal. Yes, by their logo, by their signal, you know them.
Thank you so much, Mas. Thank you for your time. Thank you for giving us your knowledge, your experience in this field. It has been a wonderful time in the presence of the Lord, talking to people on their health. Mommies, Lórúkọ Jésù, I pray that God will continue to increase you. And this platform, God will continue to expand this platform so that people will know the right thing. I told you the other time that it's an eye-opener. I will not do the wrong thing again. And I know viewers that are watching us will have the rethink concerning how they manage their health. Because individuals manage their health. Anywhere. Ẹlòmíì tó bá ń wù ló máa lọ, kò sí nǹkan tẹ́lẹ̀ sọ fún nǹkan tó máa ṣe ló máa ṣe. Alẹ́ mi mo ní health mi.
Ignite TV, igniting the